As a triathlete and Florida firefighter, Zach Cover knew how to push his body past the limits of pain. But in 2006, during a training ride for the Ironman competition, a teenage driver hit Zach head-on, nearly killing him.
And was out finishing, a nice long bike ride, a couple hours on the bike, a few miles from the house. Next thing I knew, I woke up in intensive care unit at a hospital. The extent of the injuries that I had, I'd collapsed both my lungs, broke every rib on both sides of my chest, broke, a leg, had my arm fractured, ended up having, nerve severed in my shoulder, broken collarbone, and, the internal injuries just went on and on after that.
Over the course of 6 weeks, Zach had 7 operations to repair his damaged body.
And was, bedridden for the better part of 6 months. My mother had to basically become my caregiver to be 26 years old, 25 years old, and have your mother have to dress you, get you out of bed, put you in the shower, dry you off, help you use the restroom. I mean, it's a humbling experience after you've been on your own for a long time, but it really kind of put things into perspective for me as well.
Although the surgeries corrected the physical damage, Zach was left with excruciating pain that lasted for years.
It became kind of a vicious cycle for me, and obviously being on the amounts of medication that I was on, you're not having a clear head and not really able to function like a normal person.
Finally, Zach found relief in a small implantable device called a neurostimulator or spinal cord stimulator. Slightly larger than the size of a U.S. silver dollar, the Eon Mini neurostimulator is used to manage chronic pain of the trunk and limbs and pain from back surgeries that have failed.
The reason Zach was such a good candidate is because he suffered multiple traumas. And during the trauma, he had nerve injury. And those nerve injuries really were not responsive to any kind of pain medication.
A neurostimulator is typically implanted above the buttock area and sends mild electrical pulses to leads located near the spinal cord.
When it listens to the impulse to the spinal cord, it blocks the pain impulses that are coming in from different areas of the body. So it sort of tricks the brain in that the brain will sense in the area of pain just a normal, smooth, tingling sensation.
One important aspect of spinal cord stimulation for patients is that they can try the therapy during an evaluation period before receiving a permanent system implant. This allows both patient and physician to determine if the therapy will be successful in controlling the patient's pain. Because the leads are temporary, patients must follow precautions after receiving a trial system. These include avoiding activities that could cause the leads to move or lifting anything heavier than 5 pounds. Following a successful trial period, a permanent neurostimulator system can be implanted. As with any surgery, there are risks involved. Possible complications include persistent pain, numbness, or weakness at or around the implantation site, paralysis, and allergic reactions to the device.
Anytime you touch a patient, there's always a risk of bleeding, infection. With neurostimulators, we want to make sure that the leads don't move. So the first 8 weeks that the stimulator's in place, we really don't want patients making any large jerky moves, bending down, picking up anything heavy, twisting, carrying a heavy suitcase, something like that.
It's been an absolute blessing. I've been able to reduce over the past 4 years to absolutely zero medication at all whatsoever, which I know isn't the case for everyone. After my accident, I was out for so long and debilitated for so long that I wasn't able to return to my work, the physically demanding nature of the job as a firefighter. So I was able to take, my medical knowledge and my medical training, the success that I had with my therapy, and had the opportunity to join the St. Jude medical team as a clinical specialist and go out and help other people, with chronic pain.
Over time, Zach has resumed nearly all of his favorite recreational activities. His neurostimulator is programmed with multiple unique customized settings that allow Zach to manage his pain depending on his activities and pain patterns.
I feel like I'm almost able to do everything I could do before my accident. Obviously, now I'm a little more cautious and tentative as I do things. I don't push myself as hard as I used to, but I'm able to get out and jog and swim and bike and kayak, scuba dive, do all the outdoor activities that I enjoy doing, with virtually no pain.
If you would like to learn more about neurostimulation, visit www.poweroveryourpain.com to access these resources. This story explains the experience of Zach Cover with a St. Jude medical neurostimulation device. The results are specific to the individual featured. While most people experience at least some reduction in pain, the amount of pain relief experienced varies by individual. The surgical placement and/or use of a neurostimulation system pose certain risks. The occurrence of these risks also varies by individual.